The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is Veronica Posada with Physician Partners. Thank you very much for participating in today's webinar on medication dispensing. I'd like to introduce our speaker today, Brian Chichara. Brian is a Senior Vice President Sales for AS Medication Solutions. He has been in the industry for over 7 years and has worked with over 400 medical practices across the country to successfully implement a point-of-care dispensing solution. He has worked with practices of all sizes and specialties. The majority of those were private practices. I'd like to go ahead and advise everyone is in muted status. And if you have any questions at any time, to please type them in on the side panel. And to get started, I'd like to launch 2 poll questions. If you would just take a few seconds to answer those questions, and I'll launch the first question here. And the first question is, do we have anyone that currently dispenses or has dispensed in the past? Please take a few moments to vote or to answer. Okay, we'll go to the second question. How do you feel your practice could benefit from RX dispensing? Okay, thank you for that, and we'll go ahead and close the poll questions. And I'm going to go ahead and hand it off to Brian. Thank you.
Okay, thank you, Veronica. Good afternoon, everyone. As Veronica mentioned, I'm Brian Chihara with AS Medications, and thank you for taking the time to attend the webinar today. I have a brief PowerPoint deck we'll go through for a high-level overview of dispensing. And then after that, we can open it up to any of your questions. Okay. By way of an agenda, what I'd like to go through today is just a little bit about our company, AS Medication Solutions, and then go into an overview of how dispensing works in the office, the key benefits for both the practice and the patients, and target specialties where it makes sense, and also return on investment, ROI, how this can be a profitable addition to your practice. Okay. And with that note, if you notice in the right corner, the circle there, you know, dispensing really makes sense for almost all practices. We work a lot with, of course, a lot of people know urgent care and primary care are typical settings where dispensing takes place. I understand there's some dermatology practices perhaps on the call in orthopedic and also some multi-specialty groups. We work in with a great number of those type of practices as well, and I'll go into more detail on that. So just one slide on on who we are, but we are the nation's largest supplier of on-site dispensing services, and we've been in the industry for over 26 years. We operate out of a large-scale facility out of Libertyville, Illinois, and we're regulated by the FDA and the DEA as a drug manufacturer. So what we do essentially is buy medications in bulk from the manufacturers directly or from major wholesalers, and then we repackage those in unit of use size. So they're delivered to the client already prescription labeled, safety sealed, and bottled, because point of care dispensing is a fast-paced environment. So no counting or bottling pills at the office. This is all done ahead of time. Okay. Along with that, we pair our medications with an easy-to-use web-based dispensing application, okay, and we offer what I call service into all lines, meaning our clients can dispense on a cash and carry or a private pay basis to all patients, which works very well even for insured patients. But we can also help you with what's called third-party adjudication, meaning if you want to be able to take the patient's prescription card and adjudicate the claim immediately to their insurance, you can. And also workers' compensation, which is can be a very profitable revenue stream for dispensing, and also helps patients be compliant and get back to work faster. Okay. I like to just show our mission statement, but basically our goal is to strengthen caregivers by providing a point-of-care treatment solution that improves the patient health, it lowers the cost, and it enhances the revenue stream for the practice. And again, we accomplish that mission by providing prepackaged medications, offering a easy-to-use platform to dispense them to your patients from the office, and then providing the support to our clients in a number of different ways. So what is medication dispensing? Simply put, it's dispensing the medications that you commonly prescribe directly to your patient at the point of care. The first bullet, 90% of all treatment plans call for the use of prescription medications. So if you're not dispensing today, it's basically your #1 most outsourced ancillary activity. And by insourcing or bringing this activity in-house, you, one, maximize your revenue streams, but you also provide a new convenient service to your patients. Okay. And as we mentioned, we provide prepackaged medications, regulatory consulting to help you know all the laws specific to the state of California or wherever you may be located if you're outside of California, and also a platform to do this fast and easy at the point of care. So the in-office dispensing model, all medications come from our distribution center outside of Chicago, prepackaged, sealed, counted. We offer anything from pill form to oral suspension form to topicals, creams, and even injections. You only carry the medications that you choose to carry and you're commonly prescribed. So the idea is not to become a full-fledged pharmacy. You're typically going to carry your top medications that are prescribed often, okay? And then anything else that is not prescribed often, you continue sending those off to the pharmacy, okay? But for when you have it on site, instead of sending the patient to the pharmacy, you simply offer them the alternative to fill with you here and now, okay? This just shows some photos of what it might look like, the medication bottles. So again, they're prepackaged, they're barcoded, and they're safety sealed. The barcoding, when we get into the system, is a double check. So conceptually, so a user would come into the system and the information would be ready for them to dispense. They simply grab a medication and using a handheld barcode scanner that plugs into any USB port on a computer, you scan the barcode. That verifies you're scanning the correct medication. Okay, so the process works like this. In terms of workflow, for the prescriber, it's the same process they do today. They're seeing the patient in the exam room, and they create an order in their EMR system, and they transmit it. So we interface with ePrescribe, but instead of sending it to the local Walgreens or CVS down the street, it comes right into our application. We call it Pedigree RX. So then someone a staff member sees there's a prescription waiting to be filled. At that point, they remove a bottle, a prepackaged medication bottle from wherever it's stored, and as I mentioned, they'll scan the barcode on that bottle. And that verifies that they did scan the correct medication that was sent over to be dispensed. And at that point, a final medication label prints. So I mentioned the bottles are already prescription labeled. They meet all the FDA requirements. They have the 12 or 15 data points the FDA requires. They're only missing the patient name, the SIG, right, or the instructions for use, and then the practitioner's name and address. So that's going to print to the label stock that we provide. And once you apply that label to the bottle, you meet all the FDA requirements. And in addition to that, a medication information sheet, same type of information you would get at a retail pharmacy with cautions, side effects, common uses, that will print to your office printer in either English or Spanish. So you provide that to the patient, and also offer the ability to consult if they need any consultation on how to use it. Okay, that process, believe it or not, takes about 30 to 60 seconds for a staff member to complete. In the state of California, dispensing is it's certainly not new. Many physicians do it, have been doing it for a long time. All we need is a valid California medical license, which is nice because some states require a physician to get a separate dispensing license. Not in the state of California. So your practitioners already have met the requirements to dispense. If you choose to carry anything that is controlled, the controlled substance, then you would also provide a DEA registration to us, and then we check your credentials and we're ready to begin service. Okay. And then last of all, the state of California some years ago came out with very specific requirements in terms of the font size and the data that should be on the final patient label, and we provide what we call a California compliant medication label. So our labels do meet the state of California requirements. Okay. IDN, Integrated Delivery Network. This is just a kind of a breakdown of different areas that we'll provide a lot of service into. But patient pay markets, this is where we're primarily talking about dispensing medications as a revenue source to the practice, be it either on a cash and carry basis or doing third-party adjudication. Okay. And then workers' compensation, which might be more prevalent in an orthopedic type setting. Okay. And then prescription cost containment, that applies to areas such as employer worksite clinics. I don't know if anyone on this call is involved in managing or helping employers with worksite clinics, but it's one of the fastest growing areas of healthcare today. Okay. So some of the top objectives are, one, improving outcomes. We've all maybe heard or seen the statistic that 20 to 30% of prescriptions are never filled. Dispensing immediately to your patients at the point of care increases that adherence and increases the compliance. Okay. Increased revenue, which is maybe a little more obvious, but it just definitely adds a new revenue stream to your practice. Okay. Improving patient satisfaction. I always like to tell new clients, you can't expect all of your patients to choose to fill at your practice, even if they have a high copay, let's say, or if you take insurance. But for those that do choose to fill with you, your practice just became that much more valuable, another service that they find you do better or different than perhaps the competition does. And in regards to efficiency, I always like to point out, because how much time it takes is often a common question. As I mentioned, it literally takes 30 to 60 seconds to dispense medication. But on the backside, you also reduce the pharmacy callbacks that maybe bottleneck the practice throughout the day. So that's something some areas that you'll start to see some also improvement in workflow in. Okay. Dispensing in the primary care setting or the urgent care. And again, I don't know if we have any urgent care or primary care on this call, but in terms of urgent care, well, nearly half of them dispense already today. So it's almost to the point where if you're not dispensing as an urgent care, you're almost not competitive with what your peers are doing. Competitive pricing. So we're, as the largest repackager in the industry, we definitely offer the most competitive prices on medications available. And then the interoperability, which is a benefit for all practices. Again, we interface with many EMRs already, and we are SureScript certified, meaning we interface with the ePrescribe network. So that's really important for the practitioner to have the same workflow that they currently are used to today, so that their process isn't disrupted in seeing new patients. And again, we touched on some of the benefits: increased compliance, convenience, income, and it's a very simple program. If you stock your perhaps top 10 to 25 medications, you're probably going to cover about 80% of your patient's needs. I'm going to skip into here. I mentioned a little bit about worksite clinics, and again, if there's anyone on the call involved in managing employer worksite clinics, then we could talk more in detail on this, perhaps after the call or offline. Let's talk about revenue opportunities. So on this slide, we're talking about provider pay, or let's call it cash and carry or private pay dispensing. Okay. And private pay dispensing, as I mentioned, works well for nearly all patients. So in fact, insured patients we find are often the best adopters or utilizers of private pay dispensing because they have a copay at the pharmacy. So in a typical scenario, your acquisition cost for medication, typical generic, might be $3 to $7 from us, and you may charge a flat fee or some markup on the med in the range of, say, $10 to $20. And at that price, you're competitive with almost all prescription copay plans, maybe even lower than some of them. In addition, some of the patients will have deductibles that need to be met before their benefits kick in. So here you're offering them just a simple cash price for the medication, and you're making a profit on the dispense as well as helping them with all the benefits of convenience and compliance. Okay. Cost containment. Again, this applies more to the worksite clinics that I've mentioned, but we do a lot of analysis for employer worksite clinics and what they pay through the PBMs for medications versus what they could purchase them directly, and in many cases they'll even dispense them free of charge to the patients, and the employer ends up saving as much as 50 to 60% on their generic medication cost through the PBM. And then pharmaceutical claims dispensing. This applies to either doing third-party adjudication through insurance or to workers' compensation claims. One of the services we provide that's almost unique to us in the industry is we have the ability to credential our clients and as a pharmacy, and we hold more payer contracts in the industry than anyone else. So we credential clients one time, and they have access to all of our payer contracts, and in that case they can actually take the patient's prescription card, run it through our system, and it real-time adjudicates the claim. It displays the copay you should collect, and then in about 30 to 45 days you receive the third-party reimbursement for the medication. That's an option that a lot of clients do like. And that was, as I mentioned, it was going to be a brief PowerPoint and kind of a high-level overview, probably quicker than I thought, but I'd be happy to open it up to some questions.
Thank you very much, Brian. Let's see here if we have any questions that have started. Just give me one moment. Okay, we'll give the audience a few moments to ask some questions, but I did think of a question here, and you maybe covered a little bit of it. Does prescribing in the office increase liability insurance?
Great question, and I should have made it part of the presentation, and because I get it all the time, and the answer is no. And if you think about this, what I'm going to say next, it makes perfect sense. But for the prescriber, all the liability falls in the act of writing the prescription, because the patient can't get the medication unless the order was written anyway. The liability for the right pill in the bottle, if you will, that falls to us as the repackager. So there's no increased liability for the prescriber whatsoever.
Okay, great.
And Veronica, let me actually expand on that a little bit. There's a lot of thought that dispensing actually is helping reduce liability. We start to talk about physicians about what they call the pharmacy switch, where they may prescribe a very specific medication for a condition for the patient, and for whatever reason they're finding, if it's not on formulary or so, it's getting changed at the pharmacy. That's a conversation I have quite often with doctors, and something that a lot of them feel increases their liability as a practitioner.
Okay. Let's see, a question has come through, and the question is, could you address this specifically in a urology practice?
Sure, absolutely. We work with many urology practices. Urology works very well. Now, you have your choice in urology, meaning you could keep your common generic antibiotics and choose to deploy this as a cash and carry private pay basis for everybody. Or you could choose to go the route for being credentialed and accepting the patient's prescription card at the practice as well. And there's pluses and minuses to both ways of doing it. And I would say the higher the volume practice, the larger it is, then the more it starts to make sense to maybe look at doing the insurance route, third-party adjudication. And we'll always warn our clients or advise them as part of our service. You got to be careful with the high-priced brand name medications. Those can be hard in the point-of-care dispensing environment. If you're billing insurance, sometimes they come back not profitable to the practice, meaning you could lose money. And if you're doing it on a cash and carry basis, it's not as likely a patient's going to come out of pocket for high-priced brand name drugs. So it really is going to come down to the size of the practice and then working on the formulary together. But we work with many urology practices, and it's a very good fit.
Okay, great. Looks like another question has come through. Does your system do drug pre-auths for RX that require an auth?
So if you're doing third-party adjudication and you send the claim through and it requires a pre-auth, we have a help desk 24/7 that will, so the claim may reject or be held up. And this is part of actually a good part of our service that we provide. I'm glad the question came up. So instead of just leaving you hanging, if you will, you actually have a support system at our company that recognizes the claim isn't clearing and it requires a pre-auth. And at that case, in that time, we can call your practice to actually get the pre-auth from you directly and help you get the claim cleared. Okay. If you're doing cash and carry, then it really doesn't matter. It's not going to, you're just going to dispense it for cash, and a pre-auth isn't going to be required.
Okay, well, if any other questions arise, we'll give you a few more moments to type them in. And in the meantime, I'll share the poll results. And it looks like for the question of how do you feel your practice could benefit from RX dispensing, it looks like the options here were better compliance, increased profitability, better service to the patient. We had 50% answer increased profitability, and 50% answer better service to the patient. Brian, would you like to add to that?
No, I think that I like the split because in all the years I've been doing this and the hundreds of physicians and practices I've worked with, it's almost a 50-50 split. I would agree that increasing revenue to the practice is important, but also more service and a better image is and compliance too, I found to be equally important in many cases.
And let's see, sorry, I need to go to the next question here. Do you have anyone that currently dispenses, do we have in the audience anyone that currently dispenses or has dispensed in the past? And our audience said no. So I'd like to add, if anyone on this call is interested in learning more about in-office medication dispensing, to please call Brian, and let's see, his email and phone number are on the screen. And please ask about the preferred pricing that's offered to our physician partners members. And if you have any questions and by chance didn't get his information off of the screen, please feel free to call me, Veronica, here at Physician Partners at 619-359-6600, and I'd be happy to connect you with Brian. We, at this time, don't have any other questions that have come through, So
Okay.
I think we'll conclude the webinar today. Thank you so much, Brian, for your presentation, and thank you for, to our members who participated today.
Thank you very much, everyone.
Bye-bye.